Previously, the immigration rules in the UK enabled a huge number of overseas doctors to actually come and work in the UK and further their postgraduate medical training. In recent years, there's been a significant change to the immigration rules, which has made it increasingly difficult for overseas doctors to actually continue with their training in this country, even when they're graduates of UK medical schools. For example, in 2006, there was the end to permit-free training, the immigration category, which enabled a lot of doctors to come over here and study up to consultant level. And in the last couple of months, well, since February 2008, there's been a complete overview of the entire immigration system in the UK, which has taken over 80 pre-existing immigration categories and restructured them into a 5-tiered immigration system. The recent changes to the immigration system relate to Tier 1, which was introduced in February 2008, but which recently was revised so that individuals applying to it have to meet new and increased requirements to apply successfully. In particular, I'm referring to the level of educational standards that an individual needs to apply to Tier 1. Previously, people would attain points towards their Tier 1 application for actually having a bachelor's level of education. That has now been raised to a master's. Our particular concerns relate to the fact that medical degrees, even those attained within the UK, are normally only classified as bachelor level degrees, which means that those doctors who have a medical degree as their sole educational qualification will not be able to apply to Tier 1, as they will not acquire the appropriate number of points to be able to apply to Tier 1 successfully. This change to the Tier 1 requirements actually has quite significant and worrying implications for international medical students and recent graduates of UK medical schools who studied as international students. Basically, it means that although on graduating from medical school they will be able to complete the foundation programme under Tier 4, which is the category for students, at the end of the foundation programme they actually will have no appropriate sort of immigration route that they can go into to actually enable them to complete their specialty training. The only exception to this is if they have a confirmed job offer and their employer can actually demonstrate there is nobody suitable from the UK or the EEA to actually take up that post. This is a process that involves employers advertising posts widely and meeting a number of quite stringent requirements through the UK Borders Agency. So in effect, the raised requirements has taken away the main immigration route that doctors would have used to actually continue to stay in the UK and complete their training. As well as having a severe impact on the actual career progression of these international doctors who've actually graduated from UK medical schools, there's also the quite severe personal impact that the rule changes will have on these doctors as well. Many of these are individuals who've actually lived in the UK for 7 years, some of whom have houses here, have children here, who have basically built their lives up here, and the fact that these immigration rule changes have been brought in with virtually no warning whatsoever means that these individuals are facing huge disruption to their personal lives as well as their career progression. The impact of this rule change on the actual NHS as well is of great concern to the BMA, particularly with the imminent full implementation of the European Working Time Directive in August 2009. We have significant concerns that these individuals who actually have been factored into the Department of Health's workforce planning statistics will no longer be able to continue with their training, and that this is likely to have a significant impact on the NHS's ability to fill rota gaps appropriately, and the resultant impact that this might have on patient care. The BMA in recent weeks has written 2 letters to senior government ministers raising its concerns about the recent changes to the Tier 1 system. Our first letter was to Phil Wallace, the Immigration Minister. Within this correspondence, we highlighted our concerns about the revised structure to the Tier 1 system. Our second piece of correspondence was to Alan Johnson, the Health Secretary. Within this bit of correspondence, we actually documented in more detail our concerns about how the Tier 1 change might impact the medical workforce and the ability of the NHS to actually fill the gaps that it currently has. On top of this, the international department within the BMA is handling a significant number of inquiries from BMA members who have actually been affected by this rule change. So we've been offering personal advice and guidance to those doctors who have contacted us directly as well.